Well, thanks, Pamela. Now, there are rising concerns that the country could be seeing the start of the fifth wave of COVID-19 infections, possibly driven by a new subvariant of Omicron. Our daily COVID-19 infections recorded over the last 24-hour period have registered 3,222 new cases after the numbers were sitting at over 4,000 new infections for at least 3 consecutive days, with most cases recorded in Gauteng, KwaZulu-Natal and the Western Cape. Professor Ramneek is a medical expert as well as CEO of Higher Health, and he joins us now for a conversation about this. Professor, good to speak to you again. It's been a minute. Welcome to Morning Live.
Good morning, Sakina. Thank you very much, and good morning to everyone.
So, Professor, with the seeming rising of daily infections, do you think that we should be concerned at this point?
Definitely, Sakina. We've seen that over the last 3 days, our positivity rates have increased from 10 to 13 to 16.8% yesterday. We're seeing now about 4,000 cases a day, and these are people who are only the ones who are testing and we're getting to know. I'm sure when we live in Gauteng, we live in KwaZulu-Natal, when we pick our phones to our families and friends, we probably know a lot of people who are now positive. So there's a matter of concern for sure. And what concerns is that by 2 years after the virus came, as a novel virus came to South Africa, we're still far away from ending of this pandemic, which means what we thought this time we will be entering into a stage of endemic. The virus is full of surprises for us. It's mutating. It's changing its shape and color. It's continuously trying to develop being more contagious, and whenever it becomes more transmissible, even if it's a subvariant or an offspring of the original Omicron, it becomes more dominating, where it starts displacing its previous sublineage or a subvariant. Secondly, we start seeing different clinical patterns. This virus changes its color and shape, which means it becomes slightly more virulent, or we start understanding the different clinical patterns to compare the original Omicron used to be. And what we also seeing is evading immunity. And what's clearly is that, which is a natural phenomena, that our immune system, even when 80% of South Africans acquired natural immunity while they got infected during the first, second, third, and fourth wave, unfortunately, that immunity does wean down, giving the virus an opportunity to reinfect or come back into human lives. And that's what we exactly seeing as I speak to you right now. And I think we need to be very careful. Seems to be a very difficult winter coming in. We're definitely seeing high flu cases, but we're going to see a very parallel, approximately a fifth wave in its very closeness to South Africa. And I think this is a time for us to put a caution, to be alert. No panic, because it's still an offspring of Omicron, what we're seeing currently from the BA4, BA5, which means hospitalization are still far minimal. But we can't let our guards down at this stage. Absolutely not.
So let's speak to the winter months and the increase in the number of flu cases, Professor. Many people saying, well, it is to be expected that we would see the numbers going up, and therefore don't seem to be too concerned. Add to that the number of hospitalizations and deaths that also seem to still be low. And should we be reading anything into that? How do you then convince people that they should, in fact, be concerned at this stage?
So I think, let me explain in a very simple way. When the original coronavirus came, it started developing its different mutations, and we saw Alpha as a new variant, Beta variant that caused us our second wave. Then there was a Delta, which was highly virulent and very contagious, caused us a third wave. And then came Omicron. And within 4 years, our genetic sequencing or genetic understanding has become very stronger of this virus. And now what we are seeing is also now picking up the offsprings of all these variants, specifically the Omicron variant. But what we need to know is that the Delta still remains in our system. The Alpha, the Beta, and now the Omicron, they're all there. And what they're doing is they're continuously changing their shape and color and developing into more variants. So what these new variants will be doing is there will be something called evading immune system. And when I'm talking about evading immune system means they come inside the body, they change the shape and color so that we can't recognize it. And when our immune system does not recognize it, they still take a heavy toll of our body. So far, we have seen that as 80% of South Africans have some acquired immunity and many have boosted that immunity via vaccine, we say that even though it escapes, we have something called first, second, or third line. So even if our first line fails or second line fails, somewhere the third line picks it up, remembers it, and then starts overpowering while the virus dominates for some time in our body. And that's what we call breakthrough infections or reinfections. So I think what we need to be careful is that this is a virus which does evade our immune system, is trying to evade our immune system. It's going to continuously do. It's also going to continuously becoming more contagious. And that's the only way it will replace its mother offspring or its sister offspring who's currently dominating. So a fifth wave will be caused by a variant that will be able to displace the current Omicron variant or its sublineages because it will be more powerful. And the last thing is what we're also seeing with this mutation is clinical patterns. This virus is full of surprises, which brings us very different clinical patterns to what the original COVID came or what we saw in the Delta variant, and now what we're seeing even in the sublineages of what the BA1 and BA2 did to BA3 and BA4 or BA5, which means these sublineages of Omicron are also trying to change their color and shape to be more dominant or trying to be more stronger when they enter a human body. So I think not letting our guard, being very alert that we're dealing with an airborne disease, we're entering into winters, we're entering into exactly what the virus enjoys. And I think not giving the virus the opportunity to overcome us and we doing those simple preventative, timelessly possible of getting boosted or through our vaccine, wearing a mask in congregations, making sure ventilation is on. These 3-4 things when an airborne disease is there is critical when you're fighting such an enemy.
So just in terms of non-clinical interventions, what should South Africans be doing at this point, Professor Ahluwalia, to try and prevent further infections?
I really plea, as much as the national state of disaster has been dropped down, my plea to all South Africans is we are far away from this pandemic getting over, even not to a stage of endemic, which means this virus is still trying to fight with our human body and try to live within our human body as freely as it enjoys, doesn't have any seasonal pattern. And at this moment, when we're entering winters, it's an airborne disease, which means it spreads via aerosols. And what we have to find is how do we stop an airborne disease? Simple 3 things. As much as it sounds simple, it's very difficult, but I appeal to the public. 1, wear a mask in a congregation setting. When you're in a closed space, in a closed, crowded space, do wear a mask. Ensure that if you have even the mildest symptoms which look like flu, wear a mask and ensure that you do not transmit this to the most elderly or the most vulnerable, because this virus is still a killer for lots of people who are elderly or people who have comorbid conditions. So mask is very sensitive in closed classrooms, your laboratories, you're in offices. Second thing is keep the doors and windows open. Even though you have to wear an extra jersey, please do it this winters, because ventilation is going to disperse the aerosol, make it grounded on the floor and kill the virus very quickly, because what will happen is a good ventilation always helps. It's not going to help you only in COVID. It will help you with the normal other flu viruses that are going to dominate us. And what we've seen with the Northern Hemisphere is we are preparing ourselves for a very more severe winter. We saw floods in KZN, which were very hard, that came to South Africa, and that's part of the climate change. And we've seen just what our siblings or our families or our population in Northern Hemispheres has seen. So we're trying to understand the pattern in South Africa. So we have to be extremely careful. And the third thing is get your boosters of vaccines. And I really plea, 80% of South Africans have natural immunity. It's brilliant. But somewhere this immunity starts going down. This is a natural phenomena that the immunity with time weans down, which needs to be continuously boosted, not giving the virus or a new variant an opportunity to invade our body or override our body because our immune system was at low. So timelessly boosters of vaccines will be very, very sensitive and critical in order to prevent the severe winters that we expect coming in. And that would be my advice, Sakina.
Dr. Ahluwalia, thanks so much for your time, as always. And Professor Ramneek Ahluwalia there from Higher Health talking to us about this fifth wave that we've been entering and cautions that we should be concerned about not just the uptick in the numbers of COVID, but of course it's flu season and how this new variant has mutated to once again try and deceive. So please, please be careful out there. Let's bring you some news headlines now.